news day continues here on One News Now. I'm Riza Diaz. The Health Department reports over 8,100 new COVID-19 cases. This has brought the total infections to more than 1,588,000, over 60,000 of which are active cases. At least 167 new COVID-related deaths were also reported today, pushing the total deaths to over 27,800. Now, overall recoveries stand at 1,500,000, with 9,100 new recoveries logged in the past 24 hours. The Octa Research Group has warned of the rising COVID-19 infections in Metro Manila over the past week. To give us more details about this alarming trend, Octa Research Fellow Professor Guido David is with us on the phone. Sir Guido, good evening.
Hi, good evening, Riza.
Professor, what's your reaction to over 8,000 reported new COVID-19 infections recorded today?
Well, obviously, we don't like that. We don't like to see big numbers. We were hoping that the numbers would decline, but this is actually sort of part of the projection that we had last week when we said the cases would likely hit more than 8,000 cases. It just occurred in a delayed manner, but this was actually part of our projections.
Sir, what does the latest trend show regarding the COVID-19 cases in Metro Manila and the rest of the country?
Yeah, in Metro Manila, the reproduction number is 1.44 already, and it's increasing. It's starting to accelerate. That is very concerning, of course. The positivity rate has already increased to 9%, and I think this last week it was at 6%. So rapidly increasing positivity rate is very, very concerning. As far as other indicators are concerned, the daily attack rate is still, I believe it's still in moderate, but it's going up, so it will not be moderate soon. And also the healthcare utilization is still safe, but again, these are lagging indicators, meaning that they don't increase as quickly as the caseload or the reproduction number. Now, in other areas, we know that also in Cavite, there's an increase in cases. In Bulacan, there's an increase in cases. In Ilocos Norte, of course, increase in cases. Cebu, definitely a surge going on there, and Cagayan de Oro.
Sir, how about hospital bed occupancy? Do we have an update? Are we reaching alarming levels in that category?
Not yet in the NCR. In some regions, yes, hospital beds are at high occupancy, but in the NCR, it's still, I believe it's somewhere around 46% or so. It is increasing, but it's not yet in critical level.
Sir, in Octa's view, will the GCQ with heightened restrictions that's being implemented, then the ECQ, be enough to address the rise in cases?
We hope so. It was able to address the rise in cases last March and also last year in August. August, we had a 2-week lockdown, and it was sufficient to decrease the number of cases because the number of cases then was still less than 2,000. Last March, we had a 7-week lockdown. It decreased the number of cases after 7 weeks. But we had the lockdown at 5,000 cases. So right now, we're banging on the early intervention. We're averaging about 1,150 cases per day in the NCR. That's increasing. But hopefully, because of the early ECQ, this will not increase much past 2,000 cases per day in NCR. 2,500, sorry.
Sir, aside from Metro Manila, are there other COVID-19 hotspots in the country?
Yes, these are Cebu City, Mandaue, Lapu-Lapu, Cagayan de Oro, Alawag, Ilocos Norte is still a hot spot, and also Bacoor and Imus.
Finally, sir, how are the projections looking like by the end of August?
Well, if we didn't have the ECQ, we might reach 8,000 or more cases per day just in the NCR. right now we're at 8,000 cases nationally, but just in the NCR, we might reach 8,000 per day if we don't have the ECQ. But right now, what we're seeing is that we're hoping that it will decrease starting, not immediately after the ECQ, but sometime before the end of August. It will be controlled at below 2,500 cases.
Certainly hope for the same thing. Thank you very much. That is, of course, Octa Research Fellow, Professor Guido David. Now, have you recovered from the coronavirus but are still experiencing COVID-19 symptoms? Well, you may have a post-COVID-19 condition called long COVID. How long will symptoms last and what are your treatment options? Let's get the answers from the World Health Organization in this video.
If you have recovered from COVID-19 but are still experiencing some symptoms, you could have what is known as post-COVID condition. This is also referred to as long COVID sometimes. Hello and welcome to Science in 5. I'm Vismita Gupta-Smith. We are talking to Dr. Janet Diaz today. Welcome, Janet. Janet, let's talk about the symptoms that should alert a person that they may have this condition.
So some of the most common symptoms of post-COVID-19 condition, or as you said, long COVID, include shortness of breath, cognitive dysfunction, which people call brain fog, as well as fatigue. Those are the three most common. However, there has been more than 200 symptoms that actually have been reported in patients. So that list is quite long. So other symptoms that patients or people may experience includes things such as chest pain, such as trouble speaking. Some have described anxiety or depression, muscle aches, fever, loss of smell, loss of taste. So the list is quite long, but those top three are the ones that have been described.
Janet, how long does this condition last?
Our understanding of the duration or how long this condition lasts is still not completely clear. It has been described that the condition can last 3 months. Some have described as long as 6 months and potentially up to 9 months. But as you know, we're still about 1.5 years into the pandemic. There's still more studies that need to be done to follow patients who develop post-COVID-19 condition or long COVID and to see when their symptoms, we hope, resolve.
Janet, what about treatment for this condition? Do we have treatments available?
Any patient or person who develops post-COVID-19 condition should go seek care. The care pathways should be multidisciplinary in nature, meaning that they can include your primary care provider as well as relevant specialists, rehab professionals, social care workers, psychosocial workers, mental health professionals, and that's the type of care people with post-COVID-19 condition should receive. In regards to specific treatment, we don't yet have one. The reason is because we don't yet understand why this develops. So as we're learning more about the actual reason or mechanism of the disease developing, then we hope to have a specific treatment.
Janet, what do we know so far about vaccination and post-COVID-19 condition?
So there's still a lot to learn about the impacts of vaccination and post-COVID-19 condition. However, it is very clear that preventing SARS-CoV-2 infection, preventing COVID-19 is the best way to prevent the development of post-COVID-19 condition or long COVID. So the use of vaccines, we know, reduces hospitalization, reduces mortality, and so all those that are eligible should do that. Public health measures such as mask wearing in the appropriate places, physical distancing, hand washing are also extremely important to prevent COVID-19.
Thank you, Janet. That was Dr. Janet Diaz. Until next time then, stay safe, stay healthy, and stick with science.
For more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.